Hi everyone, Dr. Paul from Hair Transplants Melbourne. One of the common questions that I get asked is what causes hair loss? Broadly speaking, there's marked pathological causes of hair loss and then there's non-pathological causes. The typical cause, particularly in men, is what we call male pattern or androgenic related hair loss. It follows a typical pattern in men where they start receding at the hairline, they get those really peaked areas either side of the forehead. They can lose hair in the mid-scalp and also in the crown. And that's typically related to the grafts or the hair follicles in the top of the head finding a hormone called dihydrotestosterone toxic. Some men are just more genetically predisposed to have their grafts more sensitive to dihydrotestosterone, also called DHT. And in those men, they tend to lose their hair at a more rapid rate. Now, women can also have male pattern hair loss, and sometimes androgen blockers can be used in women for this kind of hair loss in females. It's often found in women with polycystic ovarian syndrome and more of a hyperandrogen or high androgen state. So we usually want to drop the dose of or the levels of DHT in the scalp, and we do that by blocking conversion of testosterone to dihydrotestosterone so that the grafts get a chance to grow. Outside of that, there are metabolic disorders that can cause hair loss. An underactive thyroid, sometimes even an overactive thyroid, can cause excessive hair loss or hair shedding. Sometimes we can get instances where people are vitamin D or iron deficient. Vitamin D and iron are two very critical elements to someone's metabolic status that will contribute to hair loss. So checking those levels is important. We can also have instances where someone has traction alopecia, where particularly a lot of females, when they pull their hair back tight into a ponytail, they can damage the grafts in the area, particularly around the hairline, and they lose hair in that area, and that's typically traction alopecia. There's other more behavioural types of hair loss, such as trichotillomania. It's a strange name. It's where people have a tendency to just pull their own hair out, and that is difficult, obviously, to treat because it is quite behavioural and often related to disorders of anxiety, that kind of thing. Then there's other more serious pathologies of hair. So there's the frontal fibrosing alopecia, the lichen plantar pilaris causes of hair loss, where the immune system is attacking hair grafts in the scalp and causing them to be lost. Both of those types of hair loss are typically along the hairline. They're frontal and they extend back. They can result in kind of a waxy appearance of the scalp, and they're very difficult to treat. There are other disorders that are falling into the autoimmune category of hair loss, and that includes things like rheumatoid arthritis, lupus, a lot of other connective tissue disorders that can also spill over into hair loss.